GLP-1 Agonists Explained, the science behind Ozempic and Wegovy. In 2023 and 2024, two drugs became household names, Ozempic and Wegovy. Both contain the same molecule, semaglutide. One is approved for type 2 diabetes, the other for obesity. Together, they represent the most significant advance in metabolic medicine in decades. But what exactly do they do, and why do they work so well? Welcome to Medical Sciences Unfolded. Today, we explore the complete mechanism of GLP-1 receptor agonists, from the gut hormone they mimic, to the brain circuits they alter, to the clinical trial data that has transformed treatment of two of the world's most common diseases. Let's start with the hormone this drug class mimics, GLP-1. Glucagon-like peptide 1. This is an incretin hormone naturally produced by L cells in the small intestine and colon in response to food. It has a short half-life of just 1 to 2 minutes before the enzyme DPP-4 degrades it. Its natural role is elegant. It tells the pancreas to release insulin when glucose is present, suppresses glucagon, slows gastric emptying to reduce post-meal glucose excursions, and prolongs satiety. Semaglutide is a synthetic analog of GLP-1 that shares 94% structural homology with the natural hormone, but a key modification attaches a fatty acid chain to a lysine residue, allowing the molecule to bind albumin in the blood. This dramatically extends its half-life to approximately 1 week, which is why semaglutide can be administered as a once-weekly injection. This pharmacokinetic innovation transformed a fleeting gut signal into a sustained therapeutic. How does it control blood sugar in type 2 diabetes? GLP-1 receptors on pancreatic beta cells respond to semaglutide by increasing insulin secretion, but only in the presence of elevated glucose. This is the glucose-dependent mechanism that makes GLP-1 agonists safe. They don't cause hypoglycemia on their own, because when blood sugar is normal, insulin release is not triggered. Simultaneously, semaglutide suppresses glucagon from alpha cells. Glucagon is the hormone that raises blood glucose by promoting hepatic glucose output, so suppressing it during the fed state prevents unnecessary glucose release. Gastric emptying is also slowed. Food moves more slowly from the stomach into the small intestine, blunting post-meal glucose excursions and prolonging satiety.
But the most transformative effect of semaglutide, and the reason Wegovy at 2.4 milligrams weekly produces average weight loss of 15 to 17% of body weight, is its action on the brain. GLP-1 receptors are expressed throughout the central nervous system, particularly in the hypothalamus and the brainstem's nucleus tractus solitarius. These are the regions that regulate hunger, satiety, and food reward. When semaglutide activates these receptors, it reduces appetite, decreases food cravings, slows gastric emptying, creating prolonged fullness, and blunts the hedonic response to food, the pleasure-driven desire to eat beyond metabolic need. Patients consistently report that food simply becomes less important to them. The relentless hunger that drives obesity is, for many patients, significantly quieted. The STEP clinical trials, which tested semaglutide 2.4 milligrams in non-diabetic obese adults, showed an average weight loss of 14.9% over 68 weeks, compared to 2.4% on placebo. Crucially, participants also showed improvements in blood pressure, lipids, and inflammatory markers. In the SELECT trial, published in 2023, the largest cardiovascular outcomes trial ever conducted in obesity, semaglutide reduced the risk of major cardiovascular events, heart attack, stroke, and cardiovascular death by 20% in obese or overweight patients without diabetes. This established GLP-1 agonists as cardioprotective agents, not merely weight loss drugs. The SUSTAIN and PIONEER trials confirmed semaglutide's superiority over other GLP-1 agonists and older diabetes drugs in reducing HbA1c. The drug is now considered first or second line in most major guidelines for type 2 diabetes, alongside metformin. What about side effects? The most common are gastrointestinal, nausea, vomiting, and diarrhea, particularly during dose escalation. These are a direct consequence of slowed gastric emptying. Starting at low doses and titrating slowly minimizes these effects. Rare but serious concerns include pancreatitis, and in patients with a personal or family history of medullary thyroid carcinoma, or MEN2, GLP-1 agonists are contraindicated due to thyroid C-cell tumor findings in rodent studies. The pipeline continues to evolve. Tirzepatide, sold as Mounjaro and Zepbound, is a dual GIP and GLP-1 receptor agonist that shows even greater weight loss of up to 22% in the SURMOUNT trials. The era of metabolic medicine has fundamentally changed. GLP-1 agonists are not a quick fix. They are a window into the biology of hunger, obesity, and metabolic disease. And they may be just the beginning. Thank you for watching Medical Sciences Unfolded.